If someone told you that the balance exercise your doctor recommended could actually be making things worse after 60, would you believe them? Most people wouldn't. They'd keep doing it day after day, standing on one leg by the kitchen counter, thinking they're doing something great for their body. But here's what nobody is telling you. That single exercise, the one that's been plastered across every senior fitness article for the last 2 decades, is not only incomplete, it may actually be increasing your risk of a dangerous fall if it's the only thing you're relying on. Today I'm going to show you exactly why standing on one leg falls short for people over 60, and more importantly, I'm going to give you the specific alternatives that actually work, that actually protect you, and that are backed by the most current research in fall prevention and balance science. So stay with me, because by the end of this video, you're going to have a completely new understanding of how your body maintains balance, and you're going to know exactly what to do about it. Let's start with the big picture. Balance is not a single skill. That's the fundamental misunderstanding that leads so many well-meaning fitness instructors and even some healthcare providers to oversimplify their recommendations. When you stand on one leg, you're training one tiny piece of a very large and complex puzzle. Your body actually uses 3 separate systems working together in real time to keep you upright. There's your visual system, which gives you environmental cues. There's your vestibular system located in your inner ear, which detects motion and changes in head position. And then there's your proprioceptive system, which consists of thousands of tiny sensors in your muscles, joints, and skin that tell your brain exactly where your body is in space without you having to look. After the age of 60, all 3 of these systems begin to decline simultaneously. That's the reality. And standing on one leg while holding a kitchen counter mostly challenges just the proprioceptive system, and even then only in a very controlled, static environment. Real life doesn't happen in a controlled, static environment. Real life is unpredictable, uneven, and fast-moving. So, if your balance training doesn't reflect that reality, it simply won't protect you when you need it most. Now let me explain what actually happens in your body as you age, because this context is going to make everything else I tell you make much more sense. Starting around the age of 50 and accelerating significantly, after 60, you begin to experience a process called sarcopenia, which is the progressive loss of muscle mass and strength. By the time many people are in their late 60s, they've lost somewhere between 20 and 40% of the muscle mass they had in their 30s. But it's not just the quantity of muscle that changes, it's the quality. The fast-twitch muscle fibers, the ones responsible for quick reactive movements, are disproportionately affected. These are the exact fibers you need when you trip on a curb, when you slip on a wet floor, when you miss a step. These fast-twitch fibers are the ones that generate the rapid, powerful corrections that keep a stumble from becoming a fall. Standing on one leg does not train these fibers. It trains slow, sustained postural stability, which is valuable but far from the complete picture. Understanding this distinction is absolutely critical to redesigning your balance program. At the same time, your nervous system is changing. The signals that travel between your feet, your joints, and your brain slow down with age. Nerve conduction velocity decreases, which means the information your proprioceptors are sending takes just a fraction of a second longer to reach your brain, and then the motor commands your brain sends back to your muscles take a fraction of a second longer to arrive. In a perfect controlled setting, these delays are manageable, but when you're walking on uneven pavement and your ankle rolls slightly, that fraction of a second is the difference between catching yourself and going down. This is why training reaction speed and dynamic stability is so much more important than training static one-legged standing, especially the older you get. So what should you be doing instead? Let's walk through the most effective research-supported alternatives, and I want you to think about each of these not just as exercises, but as tools that address specific gaps in your balance system. The first and arguably most foundational movement you should be doing every single day is what's called a tandem walk, or heel-to-toe walking. This is where you walk in a straight line, placing the heel of your front foot directly in front of the toes of your back foot, as if you're walking on a balance beam. Now, this might sound simple, and in some ways it is, but what it does for your nervous system is remarkably sophisticated. It forces your brain to constantly recalibrate your center of mass as it shifts from foot to foot in a dynamic moving pattern. Unlike standing still on one leg, tandem walking trains your balance during motion, which is when falls actually happen. Most falls in older adults don't occur during standing still. They occur during walking, during turning, during transitioning from one surface to another. Tandem walking begins to address those real-world conditions. Start by doing this along a hallway or near a wall for safety and aim for about 20 steps in each direction twice a day. As you get more comfortable, try doing it with your arms crossed over your chest rather than held out to the sides, which removes one of your compensatory strategies and forces your core and lower body to do more of the stabilizing work. The next exercise I want to introduce you to is one that's almost completely ignored in mainstream senior fitness content, and that is a tremendous mistake. It's called perturbation training, and before you get intimidated by that word, let me tell you it's actually quite straightforward to do at home. Perturbation simply means an unexpected disruption to your balance. When your physical therapist gives you a gentle push, or when you walk on a slightly uneven surface, that's perturbation. Your body's ability to respond to perturbation is arguably the single most important factor in fall prevention. Here's a simple way to introduce perturbation training at home. Stand near a sturdy surface, shift your weight slowly from foot to foot, and occasionally, intentionally let yourself move a little further in one direction than feels completely comfortable. Then bring yourself back. You're deliberately flirting with the edge of your stability zone. Another version is to walk slowly and intentionally step on a folded towel or a slightly uneven surface in a controlled setting. The goal is to train your nervous system to recognize instability and respond to it quickly. This is the training that builds those fast-twitch reactive fibers we talked about earlier. It teaches your muscles to fire fast, and it retrains your brain to recognize and respond to balance threats in real time. Now let's talk about hip strength, because this is where so many balance programs fall completely short. Your hips are not just about mobility, they are absolutely central to your ability to maintain and recover balance. The gluteus medius muscle, which runs along the outer part of your hip, is specifically responsible for stabilizing your pelvis when you're on one leg during the normal walking gait. When this muscle is weak, your pelvis drops and tilts every time you take a step, creating instability that radiates all the way up to your spine and all the way down to your foot and ankle. A classic sign of gluteus medius weakness is something called a Trendelenburg gait, where you can see the hips sway side to side during walking. If you've noticed that about yourself or been told about it, hip strengthening should be a top priority for you. The best exercise for the gluteus medius is side-lying hip abduction. You lie on your side with your body in a straight line and slowly lift your top leg to about 30 to 45 degrees, hold briefly, and lower it with control. Do 3 sets of 12 to 15 repetitions on each side. This sounds almost too simple, but done consistently, it creates measurable improvements in walking stability within just a few weeks. Another excellent hip exercise is the standing clamshell with a resistance band. Place a light resistance band just above your knees, stand with a slight bend in your knees, and open your knees apart against the resistance of the band, then bring them back together. This directly targets the hip external rotators and abductors in a functional standing position. And unlike lying exercises, it trains the muscles the way they actually have to work in everyday life while your body is upright and managing gravity. Let's move on to something that many people over 60 genuinely don't think about as a balance tool, and that's ankle mobility and calf strength. Your ankles are your first line of defense against a fall. They're the lowest joint in your kinetic chain, and they're the first thing that has to respond when the ground shifts or when you misstep. Many older adults have significantly restricted ankle dorsiflexion, which is the ability to bring your toes toward your shin. When ankle mobility is limited, your entire body has to compensate, often by leaning forward too much or by bending excessively at the hip and knee, all of which disrupts your center of mass and makes you more vulnerable to falling. A simple and highly effective way to address this is ankle circles combined with heel raises. For ankle circles, simply sit or stand and rotate each foot slowly in large circles, 10 times in each direction, both clockwise and counterclockwise. For heel raises, stand with your feet hip-width apart and slowly rise up onto your toes, hold for 2 seconds at the top and lower back down with control over 3 to 4 seconds. The slow lowering portion is critical. That's the eccentric contraction that builds the most functional strength in the calf muscles and the Achilles tendon. Do 20 to 25 repetitions 2 to 3 times per day. When you become comfortable with this, progress to doing heel raises on a slight step, allowing your heel to drop slightly below the level of the step at the bottom of each repetition. This increased range of motion dramatically amplifies the training effect. Here's something that will surprise you. Your eyes are doing an enormous amount of your balance work, and most people have no idea how much they've been relying on vision to compensate for declining proprioception. The problem is you won't always have optimal visual conditions. You might be walking to the bathroom in the middle of the night in low light. You might be in a dimly lit restaurant. You might turn your head to look at something while still walking forward. All of these situations reduce your visual input. And if your proprioceptive and vestibular systems haven't been trained to compensate, your balance will suffer significantly in those moments. This is why including some balance training with reduced or altered visual input is so valuable. A simple progression is to practice standing with your feet together, first with your eyes open, then with your eyes closed for 20 to 30 seconds. Then try tandem standing, one foot directly in front of the other, with eyes open and then closed. Always have a wall or sturdy surface nearby. Then progress to doing some of your other balance exercises while slowly turning your head side to side or up and down. This challenges your vestibular system specifically and creates much more robust, well-rounded balance capability. I also want to spend a moment talking about something that isn't technically an exercise but is arguably just as important, and that is your footwear. Study after study in fall prevention research has shown that footwear choices dramatically influence fall risk in older adults. Thick cushioned soles, while they feel comfortable, actually reduce your proprioceptive input from the ground. The more padding between your foot and the floor, the less information your nervous system receives about what the surface feels like, how it's tilted, and how much traction is available. This doesn't mean you should walk barefoot everywhere, but it does mean you should consider lower profile shoes with thinner, firmer soles that allow more ground feel, particularly during your balance training. Many physical therapists now recommend that patients do their balance exercises in minimal footwear or even barefoot at home on safe, clean floors. It can make a genuinely measurable difference in balance performance. Now I want to address the role of the core, because it comes up in every conversation about balance, and yet it's often misunderstood. People hear core strength and they think crunches and six-pack abs. But the core muscles that matter most for balance are the deep stabilizers, the transversus abdominis, the multifidus in your lower back, the pelvic floor, and the diaphragm. These muscles work in coordination with your hips and legs to maintain spinal stability and transfer force efficiently through your body during movement. A wonderful exercise for activating and strengthening these deep core stabilizers is the dead bug exercise. You lie on your back with your arms pointing toward the ceiling and your knees bent at 90 degrees in the air, like a dead bug on its back. Then slowly extend your right arm overhead and your left leg toward the floor simultaneously, keeping your lower back flat against the floor. Then return and repeat on the opposite side. This forces your deep core muscles to work hard to stabilize your lumbar spine while your limbs are moving, which is exactly what has to happen when you're walking, stepping off a curb, or recovering from a stumble. Let me also talk briefly about gaze stability exercises, because they address a truly underappreciated component of balance, the relationship between your eye movements and your vestibular system. The vestibular ocular reflex is a mechanism that allows you to keep your gaze fixed on an object while your head is moving. When this reflex is working properly, your environment appears stable even as you turn your head. When it degrades with age, you may notice that the world seems to jump slightly when you move your head, that you feel momentarily dizzy during head turns, or that busy visual environments like grocery stores make you feel unsteady. A simple gaze stability exercise is called the VOR-X1 exercise. Hold your thumb out in front of you at eye level, fix your gaze on your thumb and slowly rotate your head side to side, keeping your eyes locked on your thumb the whole time. Do this for 60 seconds. It seems almost too simple, but done regularly, it genuinely improves the coordination between your vestibular system and your eye muscles, and this translates directly into better dynamic balance in real-world conditions. One more area I want to cover before we wrap up, and that is the importance of reactive stepping practice. This is different from everything else we've discussed because it's specifically training your ability to catch yourself after a balance disturbance has already occurred. Research from fall biomechanics labs shows that the majority of preventable falls can be avoided if a person takes a fast, appropriately placed reactive step in the right direction at the right moment. The speed and accuracy of that reactive step depends entirely on whether those neural pathways have been trained and kept sharp. A safe way to practice this at home is what's called voluntary stepping practice. Stand in a stable position and intentionally shift your weight forward to the point where you must take a step to catch yourself, then take that step quickly and deliberately. Practice stepping forward, stepping to the side and stepping backward. You're essentially practicing the save. Your nervous system learns by doing, and repeatedly triggering and successfully completing these reactive steps trains the exact responses you'll need in a real fall scenario. Always practice near a wall or with a sturdy chair within reach. To bring all of this together, the core issue with standing on one leg as your primary balance strategy after 60 is not that it's bad, it's that it's insufficient, incomplete, and doesn't reflect how balance actually works in the real world or the specific ways that balance declines with age. What your body actually needs is a multi-system approach that trains dynamic stability during movement with tandem walking and voluntary stepping, that builds hip and ankle strength with targeted exercises, that challenges your vestibular system through gaze stability and head movement practice, that builds reactive speed through perturbation and reactive stepping training, and that occasionally reduces visual input to strengthen your non-visual balance systems. Together, these strategies address the real causes of age-related fall risk and create the kind of robust, adaptable balance that protects you in actual life, not just in a physical therapist's office. If you found this information valuable, make sure to subscribe to the channel, like this video so more people can find it, and drop a comment below letting me know what topic you want me to cover next, whether it's knee pain, back strength, or any other aspect of healthy aging. I read every comment and your feedback directly shapes what I create next. Take care of yourself, stay consistent with your training, and I'll see you in the next one.